While many of us are familiar with hepatitis A, B, and C, you might be surprised there are also strains D, E, F, and G, and each strain spreads through different means. Type A is only contracted through the stool of an infected person, while types B and C can be contracted through blood or other bodily fluids. Type D is unique in that it can only exist if you already have hepatitis B. It's most often contracted through intravenous drugs or an infected blood transfusion. Type E is largely contracted through contaminated water and is found most prominently in the Orient. Hepatitis F and G are very rare mutations of existing hepatitis types. As of yet, how they are contracted is unknown. Dr. Tran of Advanced Gastroenterology and Surgery Associates tells us about breakthroughs in treating those diseases.
First of all, hepatitis is a viral infection. The reason why it's called hepatitis is because these viruses have an inclination for the liver. It does not lead to a chronic infection. It can be contracted orally, meaning eating contaminated, for example, seafood, raw seafood. People will get sick, but then the immune system will help them to get over, and the virus does not linger. Hepatitis B and C, of course, they can be acute, but they also cause chronic inflammation to the liver. Hepatitis B and C are usually through contaminated body fluids. So, for example, exposure to contaminated blood products such as needle sticks, so healthcare workers. That's why healthcare workers are screened for B and C. Body fluids such as sexually transmitted body fluid. It causes a chronic inflammation to the liver cells and agitation that will cause the liver to be chronically inflamed, and that's a continuous process. So therefore, over a period of time, the liver cells are damaged, and then they form scar tissue, initially called fibrosis, and then the ultimate end stage is cirrhosis. And of course, you know, with cirrhosis, there can be many complications related to this condition in and of itself. Now, remember, the goal of treatment for chronic hepatitis B and C is to suppress the virus low enough to where they will not continue to cause damage to the liver cells. So hepatitis B there is treatment, and of course hepatitis C, there is also treatment for that as well.
For more information on Advanced Gastroenterology and Surgery Associates and their services, please click the Hepatitis Treatment story link icon on our homepage, yourhometownhealth.com.